Thank you for agreeing to take part of this small brief interview about alcohol, substance abuse, or any tobacco use. This interview will be asked within the lifespan of your intake of these substances. These substances can be snorted, inhaled, injected, and anytime it is injected, it can be in any shape of a pill form. These list of questions will be described, like I said, in the past 3 months or in your lifespan. By any chance if a doctor has medicated you with these medications or any type of medications, it will not be recorded in this interview. But by any chance you are frequently using it without any type of instruction, then of course please let me know. Other than that, this interview is going to be sacred. It's going to be within these walls, and will be confidential. Okay. So I'm going to go through these list of questions, and please let me know. These questions will be used whether you may say a yes or a no. And of course, some of them are a little more detailed when it comes to your intake of any substance abuse that you have cleared yes. It'll be stated no, never, once a month, monthly, weekly, or daily or almost daily, okay? So for the first set of questions, in your life, which of the following substances have you used? Tobacco products.
Yes.
Alcohol beverages.
No.
Cannabis.
Yes.
Cocaine.
Yes.
Inhalants.
No.
Sedatives.
No.
Hallucinogens.
No.
Opioids.
No.
Any specific substance abuse?
No.
Okay, so with the familiarity of the questions you've asked, there was only 2 substance abuse drugs that you have mentioned. So with those 2, we're just going to go into detail with the further questions, okay? In the past 3 months, how often have you used the substance abuse you mentioned? So with cannabis, how often have you used it? You've never used it, never had the use to use it? Maybe once or twice a month, monthly, weekly, daily, or almost daily?
Once or twice.
As for cocaine, it'll be the further amount of questions, whether it be no, never, once or twice a month, monthly, weekly, or daily, or almost daily.
Daily.
Okay, that's going to be the first set of questions. The next one will be, during the past 3 months, have you ever had the strong urge or used to use these 2 drugs? As for cannabis, would it be the same for no, never, once or twice a month, monthly, weekly?
Once or twice.
And the same for cocaine?
Daily.
Okay, during the 13 months, how often has those 2 drugs led you to health, social problems, or any financial problems? Would it be no, never, once or twice a month, monthly, weekly, daily?
For cannabis, never.
And how about cocaine?
Daily.
Okay, the next set of questions would be, with the 2, within the last 3 months, how often did you use them? And then also, when it comes to your intake, how well have you expected to not use them? Have you tried to get off? Whether it be for cannabis, no, never, monthly, no?
No, never.
How about for cocaine?
Yes, I've tried.
Has a friend or relative ever asked you or have had any concerns within the drugs? No, never?
Yes.
Within the past 3 months?
Yes.
Yes? How often? Within the past 3 months, or yes, but not within the past 3 months?
Within the past 3 months.
Okay. Have you ever tried to cut down or stop using the drugs for cocaine?
Yes.
3 months, within the past 3 months, or not within the past 3 months?
Yeah, within the past 3 months, but I'm just using again.
Okay. And how for cannabis?
Not within the past 3 months.
Okay, we finished the following questions. Now we're just going to go over each set of questions, whether it be the yes or no or the more detailed, have score points. I'm going to go down the score. I'm going to score all the points down, and it's going to level the amount of low, moderate, or extreme risk or high within the two drugs. Okay, as for your score, for cannabis, you had a score of 19. And within the score of 19, between a 4 to a 26, it's considered moderate. Within moderate, it's you'll receive a brief intervention. And as for cocaine, you scored a 42, so that's above a 27. So that's more intensive treatment. So you're point of high risk for cocaine and a medium risk for cannabis. So within these two drugs, I'm going to go ahead and ask a few questions, and you're going to let me know which of the following are associated within your drug use. As for cannabis, do you experience problems with attention or motivation?
No.
How about anxiety
No.
or paranoia? Okay. High blood pressure?
No.
Okay. Insomnia, bronchitis?
No.
Okay. Heart disease or chronic obstructive of airways?
No.
No? Okay. So because you're within the moderate range, you may be experiencing those. Of course, with your extensive use of cannabis, if it ever gets to that point, you will slowly start seeing these levels of experiences, okay? The next one will be cocaine. Do you have difficulty sleeping?
Yes.
How about heart racing, heart aches?
Yeah.
How about cringing?
No.
No. Aggression?
Sometimes.
Sometimes, okay. Irrational thoughts?
No.
Okay. How about sudden death from heart problems? No. Financial problems or accidents and injury? Okay, because you're at a more high risk, it's not considered moderate as it is in cannabis. Within the high risk, you will be experiencing a lot of these symptoms. So by any chance, because of your intervention or the list of scores, are you at all concerned of your substance abuse intake?
Yes.
And how are you or are willing to stop?
Well, I'd be willing to use any kind of help you all offer.
Okay. Well, that conducts the brief interview, and I just hope that with our program and our treatments that you are in better care. Just let you know that these scores are accurate based off the questions that I've asked and the answers you had given me. If you have any questions, please don't hesitate in calling us. Like I said, you're in a higher risk of cocaine and moderate risk of cannabis. Please take them concernedly and don't take them lightly because they can increase, okay? Alrighty, thank you.
Thank you.